Alrighty, so tonight we're going to jump into chapter 29, which is pediatric dentistry. Um, so basically, pediatric dentistry is very similar to general dentistry, except for you're only working with kids up until the age of 18. Once patients are 18, they must go find their own new general dentist. Um, so I'm gonna kind of, as far as tonight, I'm gonna kind of just go over what to look for in general dentistry, and then at the end of me explaining all of that, I'm going to kind of show the difference between general dentistry and pediatric dentistry, and not so much like the complete difference because there's a lot of things that's different about the two. I'm basically just going to show or talk about um, the different lingos that you can say at a general dentist versus at a pediatric dentist. Okay. So, first thing first, let's jump into it. Um, so, the pediatric dental practice provides dental care for children and is often referred to as pedodontics. The pediatric specialist treats children from birth through the eruption of their second permanent molar. Sorry. The pediatric practice sometimes treats medical, mental, or emotional compromised adults as well. Um, and that can range from just the 18-year-old who has very high anxiety, patients who have a mental disorder such as kind of any mental disorder. I don't want to just go into one. There are multiple mental disorders that you can, that they would allow for that patient to continue going to after 18. Um, the scope of pediatric treatment for children includes restoring and maintaining their primary, mixed, and permanent dentition, and applying preventive measures for dental caries, periodontal disease, and malocclusion. The restorative aspect is a large part of the practice, but the primary focus of the pediatric dental practice is preventive treatment. The pediatric specialist is concerned with the basics you need and special requirements for treatment of the young patient. The pediatric dentist has 2 to 3 years of additional training after dental school. This advances, well, I'm sorry, This advanced education includes study in pediatric growth patterns, development, and behavior management. This training enables the pediatric dentist to successfully treat the emotional and physically developing child as well as the patient with special needs. Um, the pediatric office is open, and by open I mean an open floor plan. So you can 9 times out of 10, well, scratch that. Um, Most of the times you can stand in one operatory with the patient and you can see at least 3 or 4 more operatories with the patients. And I will get into that probably in a couple seconds. The pediatric office is open and friendly to make the child patient feel comfortable and secure. Pediatric office settings are creative and imaginative, just meaning a lot of different colors everywhere, a lot of animals, a lot of shapes, just a lot of things that's going to always grab the patient's eyes. The reception room usually has a large area for coloring or reading, a cage for small animals or fish tanks, toys of various age groups, and a display area with pictures of patients. Some offices actually have like a playpen, like a little play ball pen, like McDonald's have those. Of course, now with COVID going on, they cannot get into all of that, but some offices will have things like that. In some pediatric offices, the treatment areas are designed with several dental chairs arranged in the open area. And that's what I was just saying. Most of the time, you'll be able to stand up one, and you can see up two, three, four, five, all the way down the line. Um, some offices, the only thing that will separate patients is a small wall that even the patient can see over. That way, The patient doesn't feel alone. You don't want a little child to be just deathly afraid to come to the dentist and they are just terrified to be alone. Um, that gives them opportunity to see other patients and to see other patients getting work done, other treatment done, or just cleanings done. Um, Often the pediatric office will include a quiet room for patients who are difficult to manage. This room is separate and closed off from the others so that if patient management problems occur, they will not upset other children in the office. Um, like they said, most of the time it'll be called a quiet room. I've even heard it be called VIP room. Any pediatric clinic that you go to, you will know this is what they're talking about, the quiet room. No matter what the name is, it would be secluded from everybody else because you would hate to have a patient come back who was definitely afraid to go to the dentist. They've never had a dentist appointment, and this is something completely new, so they're terrified. And you would hate to finally get everything under control with them, only for someone else to bring back another patient, and they're sitting there screaming their heads off, crying and throwing a temper tantrum, and now your patient is right back to square one. They're right back being afraid. They're right back to screaming and crying because they are seeing somebody else doing it and no repercussions. Okay. Um, and not saying repercussions in a bad way. You don't want to like scold a kid for being upset. Like let them know, hey, it's okay to be upset, but we're gonna work through this together. I'm gonna be here for you. Not gonna let anybody hurt you. Not even me. I'm not gonna hurt you. Just reassure to them, hey, I'm on your team. That's all kids really want. Kids want to be heard. They want to be heard, seen, and they want to know that they're okay. Okay. Um, to be effective in managing children, a dental team must be upbeat, motivated, and aware. Kids feed off of energies, whether you want to believe that or not. If you've had a rough night and you come in and you're looking like you had a rough night, you're talking like you had a rough night, you're acting like you had a rough night, you're not going to have a good day at work because your patients are probably going to be horrible that day. And it's not like they're doing it, just to do it, but kids react off energy. And if you're not bubbling, they're not going to be bubbling. If you're not making them want to engage in what's going on or previous treatment, or even as far as just teaching them how to brush their teeth, if you're not doing it in a happy-go-lucky way, for one, they're not going to pay attention to you, and for two, they're probably going to start being really bad. The dental assistant is also an educator of both the child and the parent. Meaning, when you're in the back talking to your patient, you want to show them, hey, this is how you need to start brushing your teeth. Um, I even show my patients exactly how they're currently brushing their teeth, which scares them a little. And I'm like, hey, I know you're brushing your teeth like this, or whichever way I can tell that they're brushing their teeth. And then I correct them. So I start off, hey, I noticed that this is how you brush your teeth. Is that correct? Once they're like, yes, sir, okay, cool. So from here on out, tonight, I want you to start brushing like this. And then I will show them the correct way. After I show them the correct way, I say, okay, now you grab the toothbrush and I want you to do at least two teeth like that. So then I let them do two teeth the correct way of brushing. That way, not only did you tell them how to do it, you actually showed them how to do it. Now, once the appointment is over and you're taking the patient back to their legal guardian, you also want to explain to them. So I noticed that Billy Soon Bob was not brushing their teeth correct. They've been brushing their teeth like this, but we're trying to correct it. So if you can you start watching them brush a little bit more or a little bit better? And this is the correct way that they need to start brushing. And sometimes I even get the patient to say it in front of the parents. That way they know I actually did teach them. So I'll be like, show mom or show dad how you need to start brushing your teeth. Show mom and dad the correct way of how to brush your teeth and how you're going to start brushing your teeth starting tonight. That way, not only did you teach the child, you showed the child, and now you have taught the parent, and then you let the patient show the parent. So that's 4 different ways right there. And after that, it's kind of like, well, there's no excuse. We've showed you, you know. Um, Fear is a large factor in behavior problems with children. Some of the fears are based on feelings, attitudes, and concerns that have developed from suggestions of others, including parents, siblings, and friends. These are called subjective fears. Other fears that are based on the child's own experiences are objective fears. So, if a child has been to another office and they have been um, transferred over to you guys, most likely they kind of know what to look for. And if they had a bad experience at that other office, they're automatically going to come in sheltered. Their guards are going to be up. They're going to be terrified. And so it's up to you to break down those walls with the kids. You have to talk to them. You have to show them. You just have to really let them know, like, I'm not here to hurt you. I'm only here to fix your teeth, make you smile pretty. I even throw things like, I'd be like, "Do you see the little kids on the Disney Channel and Nickelodeon?" Of course, every kid is like, "Yeah." I'm like, "Do you ever notice how pretty their teeth are?" And they're like, "Yeah." I'm like, "That's all we're gonna do to you, buddy. Oh, that's all we're gonna do to you, sweetheart. We're just gonna make your teeth as pretty as possible. Make your teeth as pretty as you are." And if you notice the kid is really afraid, you don't have to just jump right into whatever procedure you're doing. Sit them down and talk to them. And when I'm talking to a child that's really afraid, I don't stand up. I kneel down or I squat down by them. That way they're right here and I'm under here. I want them to look down at me for a moment. And it's something about that difference of eye level. It kind of makes them feel like they are in control of everything from then on out. So I'll get down under them, I'll talk to them, I'll explain everything again. And whenever you're explaining stuff, you don't want to be rough in tone. You know, you kind of want to be a little more gentle with them, not babyfy them, but let them know, like, hey, I am here for you. I can be gentle. However, just get through to your patients that basically you love your job and you are here to show them that you love your job and that you're not going to hurt them. Um, let's see, behavior management techniques. There are many behavior management techniques. A few are covered here to provide the dental assistants with some ideas. In the management of a child's behavior, it is important not to lie to the child, but answer the questions and make explanations in such a manner that the child can relate to it on their level of understanding. Now, you got to read that again. In a manner that the child can relate to it on their level of understanding. All 4 year olds are not going to understand the same way. Okay. All 6 year olds are not going to understand the same way their 4 year old understood it. So that's why you have to get to know your patients. You can't be like, oh, it's a 6 year old, I could talk to them like this. This is a 9 year old, I could talk to them. No. Every patient is different, no matter what the age, what the race, what the sex. Every patient is different. You need to learn your patients so you can know exactly how to approach them and how to talk to them in the best way possible. Um, Consider words the child can relate to, such as raincoat instead of dental dam or pinch for the feeling of the anesthetic needle. Um, we never say shot. We never say needle. Um, those are words we do not use in pediatric. Um, but speaking of lingo, let's go over the different lingos that we have. So I'm just gonna go over a couple different procedures that you would be doing in pediatric dentistry anyway, and then I have a list of the kid-friendly terms. Okay, so for ceilings, um, instead of saying cotton rolls, you would say cotton pillows. You know, cotton rolls sound soft to us, but a cotton pillow sounds extremely soft to a child. They know what a pillow is. They know what cotton is, and that sounds amazing to them. So they're just like, oh, that doesn't hurt at all, which they don't hurt. But it's just it's easier to not explain stuff if you have kid friendly terms. Okay. Because if you say cotton pillow, they're not gonna be like, what is that? They don't care at that point. They're like, oh, okay, I know it's soft. I know it's not gonna hurt me. Um, Triangles, which I mean, a triangle is a triangle. Um, it's not really a different way you can go around it. But if the patient was to ask, well, what is a triangle? Then you could just say, little paper triangles that's placed around the top of the teeth to help keep your saliva or water away from the tooth as we prepare the tooth. That's it. Um, Instead of saying itch, we'll say blue soap. And if they ask, what's the blue soap for? You can say something like, this blue soap squirts on the tooth to wash away any food or debris that is located on the biting surface of your tooth. This prepares the tooth for the seals. Sealants or seals, okay? Kid friendly terms. Then we wash the soap off using Mr. Thirsty and Mr. Water, and then we will continue on with the process. Um, Dry and liquid, that's something else we would say. Seal is the kid friendly term for sealant. Let's see, let's go over to operative visit. So instead of saying decay, you would say something like tooth bugs or sugar bugs or cavity bugs. And if they ask what is that, a sugar bug is just the decay that's in the tooth, which requires removal. It's not a good thing to be in your tooth. It's basically a bug. Decay is the breakdown of the hard enamel in the dentin of the tooth caused by acid from a diet that includes lots of sugar and starches or improper brushing habits. For the older kids, you could probably say that just like that. But for the younger ones, you would still want to reword that a little more kid friendly. Happy air is a term used for laughing gas or nitrous oxide gas. Um, the kids love to hear happy air. They're like, oh, happy air. We don't really say laughing gas because kids are tricky. If you tell them, hey, I'm going to put this laughing gas on your nose, as soon as you set it on the nose, they are crying, laughing for no reason. And I know it's like, it sounds like, well, what's the problem with that? They're not crying. Yeah, but some of the kids go overboard and they are like chuckling and like to the point you can't get any work done, even if it's just oxygen. It's just already implanted in their head. It's laughing gas. It's gonna make me laugh. Uh, Happy air. Okay. Happy air and happy air will come out of the nose. Uh, I like to say my Mickey Mouse nose, my hippo nose. Again, kid friendly terms. Sleepy juice is what we call anesthesia. Like I say, we don't say shots, we don't say needles, we don't say blood, we don't say scary words like that. Sleepy juice, and that's what's going to numb the child's mouth or put that tooth to sleep. You can say it any kind of way. I went over the tooth raincoat, which is just a rubber dam. And if they want to know what's that for, you can tell them this raincoat is to keep all of the water that we're going to use to clean off that tooth to keep it out of your mouth. That way you can continuously breathe. Okay, they love that. Um, Back on the rubber dam, whenever you need your rubber dam ring, we call them tooth rings. And what I do is I take the rubber dam clamp and I put it around my finger like a ring. I mean, it won't go no farther than right here, but I still would put it on like a ring. And I'm like, so I'm just gonna put this little ring that's on my finger, and I'm just gonna sit it over your tooth. Okay, that's it. That's all you have to say. Mr. Whistle is our high-speed dental handpiece that whistles real loud and blows out all of the bugs from your teeth. Um, Again, high speed hand pieces are really high pitched, so Mr. Whistle is kind of perfect. Mr. Bumpy is slow speed hand piece, and that's because it's more of a rough or a bump. Okay, it bumps more. Let's go over to extraction. Um, Again, we've already covered happy air, which is the nitrous oxide gas or the laughing gas. Sleepy juice, which is the anesthesia. Um, Anytime you're talking about a tooth whose whose nerves have died or is not vital, we like to just go ahead and say abscess. And if they ask what is abscess, just tell them that their tooth is sick. You don't have to go any further, or you don't have to say, we're going to pull your tooth out. No, we don't pull teeth out. We wiggle. And half of the time, I don't even say, we're going to wiggle your tooth out. I just say, we're going to wiggle. And I leave it at that. Wiggle stick is an instrument used to wiggle the tooth. Looks later. Wiggle fingers is an instrument used to hold the slippery tooth while we wiggle it back and forth. Okay. Elevators. And space is space maintainer, which is after a tooth have been extracted or if it is missing, we may recommend a spacer. And one thing a spacer does is it holds the space for a permanent tooth to grow in the correct spot. And you'll only need that if you have to extract out a primary tooth before it is time of its erupting stage. Um, if it does have to come out, then you would have to get impressions for your fit bands and your I'm trying not to get into it because this is actually what we're going over tomorrow. But space maintainers, that's where we're gonna stop because I have a lot to go in on that. So I would like for y'all to look over well, not look over because they're not really in the book. This is just something that I put together for y'all. So just kind of go back throughout this video and kind of write down the lingos that I was telling you. That way, if you do decide to ever go into a pediatric clinic, you're already a step ahead of the game with your lingo. Because for me, when I got into pediatric clinic, that one of the hardest things was to change the way I talk. Um, and not saying like the way I talk, it was literally the terms that I needed to use. I couldn't use the same terms that I used in general dentistry or even at an ortho office because I'm working around all kids now. And I mean, at the end of the day, you want your kid patients to be 100% satisfied, 100% comfortable. I do not want any patient to leave that office feeling like they were not comfortable. Um, you want to see them laugh, you want to see them smile, but at the end of every appointment, you want your patient to be ready to come back for the next visit. Okay, so this is gonna be it for this Zoom call. Tomorrow, either tomorrow or I'll get back on for another Zoom call. I'm going to go over the different space maintainers because that is something else that we don't really talk about a lot in class, but it's really good to know once you get into the pediatric field. So y'all just go back over the kid-friendly terms, kid-friendly lingos, and once I get everything else, I'll need to jump back on here or I'll have it for y'all tomorrow. All righty, thank y'all.